Borderline disorder symptoms. Introduction.
Borderline personality disorder, BPD, is a complex and multifaceted mental health condition characterized by pervasive instability in moods, behavior, self-image, and functioning. Individuals with BPD often struggle with intense episodes of anger, depression, and anxiety that can last from a few hours to days. These experiences can lead to impulsive actions, relationship issues, and significant challenges in maintaining a stable sense of self. Understanding the symptoms of BPD is crucial for early diagnosis and effective intervention, helping individuals manage their symptoms and improve their quality of life.
Emotional instability. One of the hallmark symptoms of BPD is emotional instability, often described as emotional dysregulation. Individuals with BPD experience intense emotional responses to stressors that may seem disproportionate to the situation. This emotional reactivity can lead to rapid mood swings, where a person might feel euphoric one moment and profoundly depressed the next. The emotional shifts are typically intense and can be triggered by seemingly minor events, often leading to significant distress. This instability can manifest in several ways. 1. Intense anger. People with BPD often struggle with intense and inappropriate anger. They may experience sudden episodes of rage, which can be challenging to control. This anger is usually directed towards close relationships and can lead to aggressive behaviors, verbal outbursts, and even physical confrontations. 2. Anxiety and depression. Chronic feelings of emptiness and intense anxiety are common in BPD. These emotions can fluctuate rapidly, contributing to a persistent sense of instability. The anxiety may be generalized or specific to fears of abandonment or rejection. 3. Emotional numbness. At times, individuals with BPD may experience emotional numbness or detachment. This can be a defense mechanism against overwhelming emotions and can lead to feelings of disconnection from oneself and others. Impulsive behaviors. Impulsivity is another core symptom of BPD. This can manifest in various harmful behaviors that can have severe consequences. The impulsivity in BPD often stems from a need to escape emotional pain or gain immediate relief from distress. Common impulsive behaviors include 1. Substance abuse. Many individuals with BPD turn to drugs or alcohol to cope with their intense emotions. Substance abuse can provide temporary relief but often exacerbates emotional instability and leads to additional problems such as addiction. 2. Self-harm. Self-injurious behaviors, such as cutting, burning, or hitting oneself, are alarmingly common among people with BPD. These behaviors are often used as a way to cope with overwhelming emotions, providing a temporary sense of control or relief. 3. Risky sexual behavior. Engaging in unprotected sex, having multiple sexual partners, or participating in other risky sexual activities can be a way for individuals with BPD to seek validation or escape emotional pain. 4. Spending sprees. Compulsive spending or financial irresponsibility is another impulsive behavior seen in BPD. This can lead to significant financial difficulties and further stress. 5. Binge eating. Disordered eating patterns, including binge eating, can also be a form of impulsive behavior in BPD. Food can be used as a way to numb emotional pain or gain a sense of control. Fear of abandonment. A pervasive fear of abandonment is central to BPD. Individuals with this disorder often go to great lengths to avoid real or perceived abandonment, whether by family, friends, or romantic partners. This fear can manifest in various ways. 1. Clinginess. People with BPD may become excessively clingy or dependent in relationships, constantly seeking reassurance and validation from others. They might bombard loved ones with messages or calls, fearing that any absence indicates rejection. 2. Push-pull dynamics. The intense fear of abandonment can lead to push-pull dynamics in relationships, where individuals with BPD alternate between clinging to loved ones and pushing them away. This behavior stems from a deep-seated fear of getting hurt and a need to test the loyalty of others. 3. Manipulative behaviors. In some cases, individuals with BPD might engage in manipulative behaviors to prevent abandonment. This can include threatening self-harm or making dramatic gestures to gain attention and prevent others from leaving. Unstable relationships. Interpersonal relationships are often turbulent and unstable for those with BPD.
The intense emotions and fear of abandonment can lead to a cycle of idealizing and devaluing others. This pattern, known as splitting, can cause significant difficulties in maintaining healthy and stable relationships.
Common relationship challenges include 1. Idealization and devaluation. Individuals with BPD may initially put someone on a pedestal, idealizing them and believing they can do no wrong. However, when the person inevitably fails to meet these unrealistic expectations, they may quickly devalue them, viewing them as completely flawed or even harmful. 2. Intense conflicts. The emotional intensity and impulsivity associated with BPD can lead to frequent and intense conflicts in relationships. Arguments may escalate quickly, and individuals with BPD might struggle to manage their anger and frustration constructively. 3. Dependency and fear. Relationships can become characterized by dependency and a constant need for reassurance. This can place significant strain on partners, friends, and family members, leading to feelings of suffocation or burnout. Identity disturbance. A significant symptom of BPD is identity disturbance or a persistently unstable self-image or sense of self. Individuals with BPD often struggle with knowing who they are, what they value, and what they want from life. This can manifest in several ways. 1. Frequent changes in goals and values. People with BPD may frequently change their goals, values, and aspirations, struggling to maintain a consistent sense of direction. This can lead to a sense of confusion and instability in their life choices and relationships. 2. Chronic feelings of emptiness. Many individuals with BPD describe feeling empty or hollow inside. This chronic emptiness can be deeply distressing and may drive them to seek out new experiences or relationships to fill the void. 3. Dissociation. In some cases, individuals with BPD may experience dissociation, a feeling of being detached from oneself or one's surroundings. This can be a coping mechanism to deal with intense emotions or trauma and can contribute to a fragmented sense of self. Paranoid ideation and dissociation. Under stress, individuals with BPD may experience transient, stress-related paranoid ideation or severe dissociative symptoms. These symptoms can further complicate the already challenging experiences of those with BPD. 1. Paranoid ideation. Stress can trigger paranoid thoughts, leading individuals with BPD to become suspicious of others' intentions or believe they are being plotted against. This can exacerbate relationship difficulties and lead to increased isolation. 2. Severe dissociative symptoms. Dissociation can range from feeling disconnected from reality to experiencing a complete loss of connection with one's thoughts, feelings, or sense of identity. This can be highly disorienting and distressing, further impacting an individual's ability to function effectively. Self-destructive behaviors. Self-destructive behaviors are common in BPD and can take many forms. These behaviors are often driven by the intense emotional pain and instability experienced by individuals with BPD and can have severe consequences. 1. Suicidal ideation and attempts. Suicidal thoughts and behaviors are alarmingly common among individuals with BPD. Many people with BPD make repeated suicide attempts, and the risk of completed suicide is significantly higher compared to the general population. Suicidal behavior is often a desperate attempt to escape emotional pain or a cry for help. 2. Self-injurious behaviors. Non-suicidal self-injury, NSSI, such as cutting or burning oneself, is a way for individuals with BPD to cope with overwhelming emotions. Self-injury can provide temporary relief from emotional distress but often leads to physical harm and further emotional turmoil. 3. Reckless and impulsive actions. Engaging in reckless and impulsive actions, such as driving recklessly, gambling excessively, or participating in illegal activities, can be a form of self-destructive behavior in BPD. These actions often result in negative consequences and can exacerbate emotional instability. Conclusion. Borderline personality disorder is a complex and multifaceted mental health condition characterized by emotional instability, impulsive behaviors, fear of abandonment, unstable relationships, identity disturbance, paranoid ideation, and self-destructive behaviors. Understanding these symptoms is crucial for early diagnosis and effective intervention, helping individuals with BPD manage their symptoms and improve their quality of life.
With appropriate treatment and support, individuals with BPD can learn to navigate their emotions, build healthier relationships, and develop a more stable sense of self. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.